Welcome to the last of 3 videos that explore the application of theranostics in nuclear medicine. In previous videos, we have discussed what radiation is and how it works. We have also considered how radiation is applied both diagnostically and therapeutically in the delivery of theranostics. In this last video, we look at the application of 2 different theranostic pairs in a clinical setting. As previously discussed in video 1, the term theranostics was first used in 2002. Even though this term is relatively new, the theranostic pair of technetium-99m and iodine-131 has been used for the treatment of thyroid disorders for over 50 years. Before we have a closer look at how this theranostic pair works, let's quickly review the thyroid gland. The thyroid gland is found in the neck. Its job is to take iodine from your diet and use it to produce thyroid hormones. These hormones have an effect on most systems in the body. Most importantly, they increase metabolism and help control blood pressure and tissue repair. During their lifetime, about 1 to 2% of the population will experience the types of thyroid disease that can be addressed with theranostics. The most common type of thyroid disease is hyperthyroidism. This is where the thyroid produces too much thyroid hormone. The types of hyperthyroidism include Graves' disease and toxic nodular goiter. These diseases often cause people to experience weight loss, sweating, palpitations, and exophthalmos, or bulging of the eyes. Sometimes hyperthyroidism can also give people a goiter. A less common thyroid disease is thyroid cancer. This can cause lumps or nodes to grow in your thyroid. It may also cause one side of the gland to enlarge. Now, let's have a closer look at the theranostic pair of technetium-99m and iodine-131. The theranostic pair of technetium-99m and iodine-131 uses technetium for diagnosis and iodine for therapy. Both of these radionuclides enter the thyroid via the same biochemical mechanism, the sodium iodide symporter. This is what makes them a theranostic pair, as a distribution map of technetium is representative of the distribution map of iodine. Why do we use technetium-99m? Technetium-99m emits gamma rays that are detected using a gamma camera. Technetium-99m is a short-acting radionuclide that washes out of the thyroid over a few hours. After 24 hours, most of the technetium-99m is gone from your system. This makes it ideal for taking pictures. How is a technetium-99m scan done? Prior to your appointment, your doctor may advise you to stop taking certain medications that may interfere with the scan. Other than that, no special preparation is required. At your appointment, you'll be given an IV injection of a small amount of technetium-99m, which then swims around your bloodstream, and some of it will be taken up by your thyroid gland. After about 20 minutes, a series of pictures are taken looking at your thyroid. Some calculations are also done to work out how much of the technetium-99m was taken up by the thyroid. A doctor will look at all this information, along with any thyroid function tests and ultrasounds you may have. They do this to determine if you have thyroid disease. On the day, your appointment will take about 1 hour, and once you have finished, you can resume your normal duties. What does the thyroid scan tell us? A doctor will review both your pictures and calculate your thyroid uptake measurement. What they are looking for is to see if your thyroid has too much uptake or not enough uptake. Based on these results, your doctor will determine if iodine-131 therapy is required. If your doctor decides that you need iodine-131 therapy, here's what happens next. Iodine-131 emits high-energy beta particles, and iodine-131 therapy uses the damaging effects of these beta particles to treat thyroid disease by deliberately damaging your thyroid gland. How this works is explained in more detail in video 2 of this series. Compared to technetium-99m, iodine-131 is a long-acting radionuclide with a half-life of 8 days. This means it will take a lot longer for the radiation to leave your system. The amount of iodine-131 that you are given is based on what thyroid disease you are having treated. Because of this, there are some special precautions you need to follow when you have iodine-131 therapy. Prior to therapy, your doctor will advise you if you need to stop taking any of your medications. On the day of treatment, you will be required to fast for 3 hours. The iodine 131 therapy itself is given as a single capsule that is swallowed with a glass of water. The amount of iodine 131 you are given has been carefully selected to treat your disease. The expected benefits of iodine 131 therapy will outweigh any risk. Iodine 131 treatment will make you radioactive for a period of time after taking the capsule. It is essential that you follow some guidelines to minimize the exposure of radiation to other people. What happens after your therapy depends on what pathology you are being treated for. For the first 5 days following treatment, you must minimize close contact with all people for prolonged periods of time. This means keeping at least 1 meter distance from other people. This may involve sitting on a separate couch at home and sleeping in a different room. This will also require you to double flush the toilet after voiding for 5 days after treatment. On day 6, you are free to resume normal activities. Treatment of thyroid carcinoma. A much higher dose of iodine 131 is required to treat thyroid carcinoma. This means that treatment is given as an inpatient, and patients will stay in a room specially designed to shield other people from radiation. Daily monitoring of radioactivity means that you can't be sent home until your level of radioactivity has dropped to a safe level. Once you can go home, you must also minimize close contact with other people for 5 days. Now let's focus our attention on the theranostic pair of gallium-68 and lutetium-177. This theranostic pair uses molecular tracers for localization. How do molecular tracers work? Using the example of the treatment of neuroendocrine tumors, the pharmaceutical component of a molecular tracer is a somatostatin analog. This analog fits into the receptor on the surface of the tumor cells. A linker molecule called DOTA is attached to the analog and acts as a bridge connecting the analog to the radionuclide. The linker molecule allows either the gallium or the lutetium to be attached depending on which is required. So how does the pair work together? Gallium-68 is used for diagnostic imaging. It has a short half-life of 68 minutes, and this makes it ideal for the pictures that are taken with a PET camera. Therapy, however, is delivered with lutetium-177. Lutetium-177 emits beta radiation, and it has a much longer half-life of 6.71 days. This makes it ideal for delivering therapy. Both radionuclides are administered using the same molecular tracer. This means that in both the diagnostic and therapeutic phases of the Theranostics procedure, the molecular tracer will localize in the body in exactly the same way. This creates the ability to predict where in the body the therapeutic tracer is going to go before we deliver the therapy. This is important because it means that we can use the gallium-68 tracer to see if the tumour will uptake the tracer. If the tumour doesn't take up the tracer or only a little is taken up, it is unlikely that the therapy will work, and this means that we need to find an alternative therapy. What can this pair be used for? Currently in Australia, the theranostic pair of gallium-68 and lutetium-177 is being used for neuroendocrine tumours and prostate cancer. This offers an alternative form of therapy for patients who have not responded to conventional therapy. For the remainder of this video, we will be focusing on the application of this pair for neuroendocrine tumours. What is a neuroendocrine tumour? Neuroendocrine tumours are a type of cancer that is caused by the overproduction of cells in the neuroendocrine system. The cause of this disease is poorly understood, but neuroendocrine tumours are characterized by the endocrine metabolism and the combination of cells that exists inside them. Neuroendocrine tumours can appear in many places throughout the body. These places include the parathyroid gland, the adrenal gland, the pituitary gland, the thyroid gland, and the pancreas. What radiopharmaceutical do we use? The pharmaceutical that is used is called dotatate. Dotatate will seek out somatostatin receptors in the body, and it will lock into them. In order to visualize the dotatate molecule in the body, a radionuclide must be added. Gallium-68 is attached to the dotatate to enable imaging with a PET camera. Patient preparation is important for effective imaging of neuroendocrine tumours. Some medications must be stopped prior to the day of the scan, and oral contrast will be given to improve the CT part of the scan. Once the injection of a radiopharmaceutical has occurred, there will be about a 20 to 70 minute wait before the start of imaging. This will allow the tracer to be taken up by the neuroendocrine tumours. Overall, the imaging time takes about 60 to 90 minutes. So how does a therapy work? The radionuclide used as a therapeutic partner to gallium-68 is lutetium-177. Lutetium-177 has a half-life of 6.71 days and it emits beta radiation. As beta radiation does not move very far in the tissue, lutetium-177 is an ideal choice. It delivers its therapeutic dose where it's needed. In Australia, lutate therapy is available for the treatment of some neuroendocrine tumours. Lutate therapy utilises lutate-177 labelled dotatate to link up with the receptors on the tumour and to deliver its radiation dose. Lutate therapy has been shown to slow or stop the progression of neuroendocrine tumours and to improve a patient's quality of life. As lutate therapy is not suitable for all patients, a series of selection criteria will determine if lutate therapy is appropriate for you. What happens after selection? For patients that meet the selection criteria, a series of tests must be performed before therapy can begin. In addition to a gallium-68 PET scan, the diagnosis of a neuroendocrine tumour must be confirmed. This is done with blood testing, a CT scan of your chest, abdomen and pelvis, and a biopsy of the tumour. Some patients may also require additional scans. These can include a cardiac scan or an FDG PET scan. What happens on the day of therapy? On the day of therapy, your appointment will last the whole day. Firstly, you'll be given some anti-nausea medication. This will help for the next part of the therapy, which is an amino acid infusion. This can sometimes make people feel a little unwell. The amino acid infusion is administered to protect the kidneys. It is given as a slow infusion into your bloodstream over a period of 3 to 4 hours. 30 minutes after the amino acid infusion has begun, the lutate infusion will commence. The lutate infusion will only take 20 to 30 minutes, so it will finish while you are still having your amino acid infusion. At the end of your amino acid infusion, a whole body picture will be taken on the gamma camera. This is done so we can check on your kidneys. This therapy will be given to you in 4 separate cycles. Generally speaking, there will be a period of about 8 weeks between each cycle. How do you know if treatment is working? In between therapy cycles and after the completion of therapy, a gallium-68 dotatate scan can be performed to assess the effectiveness of the treatment being delivered. If an increase in uptake is seen in imaging after therapy has been conducted, it is a good indication that the therapy may not be working. If so, this means that we may need to change the management of your neuroendocrine tumour. This brings us to the end of video 3. This was our last in a series of 3 videos that were designed to help people understand the concept of theranostics and its application in the field of nuclear medicine. We have discussed how radiation works and how it is used for both imaging and therapy in nuclear medicine. We have also explained how theranostics is applied in detail, and we have used the examples of thyroid diseases and neuroendocrine tumours to explain how theranostics is used in a clinical setting. Thank you for taking the time to watch these videos, and we trust that you have found them to be beneficial.